Everyone. We'll get started. I'd like to welcome everyone to our second Women's Giving Circle event. My name is Marg Alden, and I'm the chair of the Women's Giving Circle, along with Shirley Abramsky, who's our honorary chair. And it's our pleasure to welcome everyone here today. It's nice to see some familiar faces, and a special welcome to anyone who is new to our group. I'd like to take a moment to share with you why I am so committed to the Women's Giving Circle. The Women's Giving Circle is about making a difference in the lives of patients through the sponsoring of research that will impact healthcare at our hospitals and in our community. Excellent healthcare can only be achieved through what is commonly referred to as evidence-based medicine. What is evidence-based medicine? Evidence-based medicine aims to apply the best available evidence gained from the scientific method, or what is also known as research, to clinical decision-making. In other words, if the results of a research study indicate that the healthcare community needs to be doing something different, the doctors will follow this evidence. But what does this actually mean? Let me share with you a real-life example how evidence-based medicine affects your healthcare today. As many of you know, I'm the executive director for the Maple Family Health Team here in Kingston. Family health teams are relatively new in Ontario, but essentially they are a group of doctors and other healthcare providers who are working together to be responsible for the delivery of comprehensive family health care. At the Maple Family Health Team, we have 25 doctors and close to 40,000 patients. Some of the most exciting new work that's being done in primary care is around prevention. For many years now, the healthcare system has really only responded when you are sick. But the future is to screen people for potential problems before systems develop so that we can delay or even prevent the onset of a disease. So here's what the future could look like. Instead of the annual physical, patients could get a call or a letter from their family doctor's office that could go something like this. Happy 50th birthday, Mrs. Smith. We hope you're having a great day. By the way, it's time for your pap test, your mammogram, and your fecal occult blood test is in the mail. Oh, and by the way, can you stop into the office for a blood pressure check? Happy birthday. This is indeed the direction primary care is moving towards. Screening to delay or prevent disease. The point I'd like to make is that we are working with a chronic kidney disease specialist at KGH, Dr. Jocelyn Garland. I mentioned Dr. Garland and the research at our last meeting, but I wanted to share with you a little bit more about Dr. Garland's hopes for the future. Dr. Garland believes we need to be screening patients earlier to pick up people at risk for developing kidney disease. The main function of kidneys is to remove waste and excess water from the body. Chronic kidney disease is a slow loss of kidney function over time. In the early stages, there may be no symptoms at all. The loss of the function usually takes months or years to occur, and it may be so slow that symptoms do not appear until kidney function is less than 1/10 of its normal capacity. The final stages of kidney disease is called end-stage renal disease. At this point, the kidneys are no longer able to remove enough waste and excess fluids from the body, and the patient will need either dialysis or a kidney transplant. And there is no cure for kidney disease. In addition to the toll this disease takes on the patient, chronic kidney disease is a very costly disease for the healthcare system. Now, Dr. Garland is frustrated. By the time she sees patients in her clinic, it is often too late to change the course of the disease in any meaningful way. Dr. Garland has a theory that there are some early screening tests that could be done to pick up patients who are at risk of developing this disease, even before the symptoms are present. In other words, identifying patients at risk so we can change the outcome of their health. But research has not yet been done to support Dr. Garland's claims. And until there is evidence, the healthcare system will not respond. Now, I'm pretty sure you agree with me when I say, I don't want this disease. I actually don't want any of the other ones either, quite frankly. And did you know that 40% of chronic diseases are preventable? That's an outstanding figure. Dr. Garland's theory is just one example of a research project that requires a small amount of seed funding to conduct a pilot study. A successful pilot would allow Dr. Garland to be eligible to apply for a large research grant that could make a tremendous impact on improving the lives of patients locally and nationally and reduce healthcare spending. Today you will hear from two guest speakers about some of the other areas of medical research where the Women's Giving Circle could make a difference. Now today is the first day of spring, and what a glorious day it is. So I was thinking the theme for today is really that the Women's Giving Circle is helping to plant that all-important seed of hope for the future. So what is next for the Women's Giving Circle? Well, your executive committee has been hard at work behind the scenes developing promotional material, our new brochure, which is on the table, and our website is now linked to the University Hospitals Kingston Foundation website, and we are actively seeking new members. I would like to introduce to you the members of the executive committee, and I'll just show you. Their names appear on the back of the brochure. So if the executive could just stand when I call out their names just for a moment. So the honorary chair is Shirley Abramsky, who many of you know. Kathy Burke is our vice chair. Marcia Shannon is our secretary. Evelyn Mason is our treasurer. Sprula, Agnes. I'm going to do it again. Okay, no, not this time. Okay, Agnostopoulos. Oh, thank you. Okay, we're getting better. Tanya Ash, who couldn't join us today. Mary Lapierre, who's right here as well. Carol Mackillop at the back, who will be saying a few remarks later on today. Sheila McDonald, and Teresa Tate, who also couldn't join us, and Lynn Van Winkle. So that's our committee. So thank you for all the hard work over the last little while. I would like to take an opportunity to thank those members that have committed their support and mention that new members are definitely welcome. We hope to have this money committed by late May or early June, so we will have, we'll be able to notify the researchers in the fall about the money we have available. So now a few points of interest. 100% of the money raised will go to research. We plan to hold at least 3 meetings a year, and in case you're wondering, membership will not be a big commitment. Every fall we will select an area of research interest, and then we will offer a call for proposals in the fall. The applications will come in January, and then we'll be vetted by research experts at the hospitals, and the Women's Giving Circle will be given the results of that competition. We will award the research grants in March or April. And a condition of the funding will be that the researchers must present to the Women's Giving Circle during the year and explain how the funding is being used and how it is making an impact on healthcare. Any papers published from the work will give credit back to the Women's Giving Circle. We also plan to hold one event in June to learn about a research area or project, or perhaps even tour a hospital research laboratory. And we promise to get the date out for that June meeting soon so that people can mark it in their calendars. Finally, I would like to say that your ideas are always welcome. We really are in this together, and our strength lies in the culture we are creating. And this culture is based on philanthropy and growing a community of like-minded women who together can have a real and sustainable impact on healthcare at our hospitals and in our community. By joining the Women's Giving Circle, you can help today's great ideas become tomorrow's reality. Or in the words of the mid-18th century philosopher, William James, the greatest use of life is to spend it on something that will outlast us. Thank you very much. I need to introduce the guest speakers, but really before I do the formal presentation, I'd like you to know that Dr. Mercer and Dr. Deeley, when they were told about the Women's Giving Circle, because it's still a relatively new concept, they responded enthusiastically and said, count us in, we definitely want to come and speak about research at our hospitals. So we're very pleased to have you here today. And they're both very accomplished, so actually I'm going to put on my classes. They're in their bios. First I'll introduce Dr. Dale Mercer, who completed medical school graduating from Queen's University in 1978. He then completed 5 years of general surgery residency at Queen's University, culminating in his fellowship in the Royal College of Physicians and Surgeons in 1983. Following which he was the Howard Wright Fellow in General. Oh, you can help tell me on some of that. Okay, thank you. The Virginia Mason Medical Center in Seattle, Washington for 2 years. He returned to Queen's University Department of Surgery in the Division of General Surgery as a general surgeon with a special interest in esophageal surgery at the level of assistant professor. In 1991, he was promoted to associate professor and obtained tenure at Queen's University. He was promoted to professor in 1999. Dr. Mercer has published 41 papers in peer-reviewed journals, 20 published book chapters, and 1 co-authored textbook, along with numerous abstracts and other non-peer-reviewed papers. He has presented at national and international meetings on principally esophageal diseases and surgical waitlist management. He has been an examiner for the Royal College of Physicians and Surgeons and a nucleus member of its test committee for general surgery. He's been appointed to the board of the College of Physicians and Surgeons of Ontario and has chaired its complaints committee and executive committees. He's also past member of its Education and Executive Committee and Governance Committees, and is past president of the CPSO. Currently, he co-chairs on the ICRC Committee for the CPSO. Okay, so you're very busy. Dr. Mercer is a member or chairman of many surgical specialty societies at Queen's University. He is the past program committee chairman and past division chairman for general surgery and is the immediate past head of the Department of Surgery. Dr. Mercer is now the chief of staff of the Hotel Dieu Hospital. Welcome. I'll introduce Dr. Deeley before the talks begin. Dr. Deeley was recruited from the U.S. National Cancer Institute to Queen's University in 1980 as an associate professor of biochemistry, as a recipient of a Medical Research Council Development Award, and was subsequently awarded a Terry Fox Team Development Award from the National Cancer Institute of Canada. In 1987, Dr. Deeley was appointed as the first holder of the Joseph F. S. Stauffer Chair and Director of the Cancer Research Laboratories, and in August 2003 was appointed as Director of the New Cancer Research Institute at Queen's. From 1998 to 2007, Dr. Deeley also served as Director of Research for Cancer Care Ontario. He is currently a professor in the Departments of Pathology and Molecular Medicine, Biochemistry, and Oncology at Queen's, and in January 2007 was appointed as the Vice Dean Research in the Faculty of Health Sciences and VP Health Sciences Research at Kingston General Hospital. Over the course of his career, Dr. Deeley has published more than 180 research papers, reviews, and book chapters that have been cited in the scientific literature more than 12,000 times, and is a co-inventor on a number of patents held by the university. In 2005, Dr. Deeley was co-recipient of the Robert L. Noble Prize, presently presented jointly by the National Cancer Institute of Canada and the Canadian Cancer Society for outstanding achievements in cancer research. And in 2007, was co-recipient of the National Cancer Institute of Canada's Diamond Jubilee Award for outstanding impact and contribution to the field of cancer research. Specifically, the paradigm-shifting discoveries related to our better understanding of resistance to cancer treatment. Thank you both for coming today. We look very much look forward to hearing what you have to say.